Hi coaches, my name is Lily, and in this video I will be teaching you how to use all of the different materials found in the first aid kit that you have for your team in the case of an emergency. This is what most first aid kits used to care for athletic injuries looks like. You need to make sure that your first aid kit contains sterile eye pads, rolls of athletic tape, tweezers, scissors, burn cream, antiseptic towelettes, alcohol wipes, sting relief pads, band-aids, trauma pads, gauze rolls, a bottle of eye wash, instant cold packs, triangular bandages, pairs of gloves, sterile gauze pads, and a first aid guide in order to ensure that you're prepared for any type of emergency or injury. Now let me teach you when and how to use each of these different materials. First, there is a sterile eye pad. This is used if someone is hit in the eye or if the eye is infected by debris such as dirt or turf and needs to be protected. To use the iPad, place a piece of athletic tape on either side of it, place the iPad onto the eye, and stick both pieces of tape to the face. Next, there is a roll of athletic tape. This is used to secure first aid materials in position on one's body, protect different areas of the body, and restrict the motion of certain joints. To use athletic tape, rip off an amount by hand or with scissors and apply it to your desired place on the body. Then there is a pair of tweezers. This is used to remove debris such as glass, splinters, or dirt from a wound or skin. To use tweezers, carefully pluck the debris from the body without irritating other surrounding parts. Next, there is a pair of scissors. This is used to cut different first aid materials to fit wounds, such as tape and dressings. These scissors can be used similarly to how all other scissors are used. Then, there are packets of wound relief cream. This is used to soothe and heal wounds, protect against infection, and treat fresh cuts, grazes, and burns. To use wound relief cream, ensure that your hands have been washed and are clean. Then you can directly apply this cream to the wound using your finger or squeezing it onto the wound. You can also put some of the cream onto a bandage or dressing and place the material onto the wound. There are also antiseptic towelettes. This is used to clean fresh cuts, grazes, and burns and prevent them from getting infected. They are also sting-free. To use the towelettes, gently rub them on and around the wound before applying additional bandages to it. Next, there is a packet of alcohol wipes. Similarly to the antiseptic towelettes, these are used to cleanse a wound prior to administering other applications such as an ointment or bandage. However, do not directly apply the wipes to the wound and instead only apply it to the surrounding areas of the skin, as otherwise it will sting. Then, there are band-aids. These are used to protect wounds and prevent them from being infected or become bigger as they heal. There are different size band-aids that can be applied to the skin depending on the size of the wound. You can also place wound relief cream onto the band-aids if the wound needs additional healing. Next, there is a trauma pad. This is an extremely absorbent and sterile dressing that is used to treat large wounds such as deep cuts in the skin and head. To use the trauma pad, apply it with pressure directly onto a wound until the wound has stopped bleeding. Then there are rolls of gauze. These are used to hold gauze pads in place and/or be used as a primary dressing for light wounds with antiseptic ointment placed on it. To use the rolls of gauze, determine how much you will need to treat the wound and cut this amount off using scissors. Then wrap the gauze roll around the desired area of the body. Make sure that it is wrapped not too tight and not too loose. Next, there is a bottle of eye wash. This is used to clean the eye and help relieve irritation and burning when debris has entered it. To use the eye wash, carefully put a few drops into the eye until the irritation is relieved. Next, there are instant cold packs. This is used to reduce swelling and numb pain. To use a cold pack, shade the contents to the bottom of the bag, locate the inner pouch and squeeze it firmly until it breaks, and shake the pack gently to fully activate it. Before applying it to the body, wrap it in a soft material such as a paper towel or cloth. Then hold it in your desired place until the swelling and pain is relieved. Then there are sting relief wipes. These are used to temporarily relieve pain from minor burns, scrapes, and stings. To use the sting relief wipes, gently rub them on the wound. Then there is a triangular bandage. This can be used for many different things. In most cases, it is used as an arm sling, as a way to hold gauze pads in place, or as support to immobilize a bone or joint that is injured. Do not apply the triangular bandage directly to open wounds. To use it as an arm sling, unravel it and place it over the body like this. Then place the arm on top of the bandage and tie both ends together so the arm is secure. To use it to hold pads or other parts of the body in place, you can change the shape of the bandage depending on how big or small the gauze pad is by bringing the sides closer together or spreading them out. Next, there is a pair of gloves. This is used to prevent infected and unclean hands from coming into contact with wounds and to prevent the handler from coming into contact with bodily fluids of the person who is injured. These gloves should be worn if a person is heavily bleeding, throws up, or if the hands of the person handling the wound cannot be cleaned. Then there's a packet of sterile gauze pads. These pads are used to stop bleeding and act as a way to protect and apply wound relief cream to wounds. To use a gauze pads, place some wound relief cream on one side, place a pad onto the wound, and secure it using athletic tape and/or gauze roll. Lastly, there is a first aid guide made by the American Red Cross. This provides you with detailed information as to how to handle different types of emergencies and injuries that you may encounter as coaches. I hope you have found this video to be very informative and you are now very prepared in the case of an emergency with your Redwood City after-school sports team. If you have any questions about this video or the materials found in your first aid kit, you can contact me at ljeffs20@ndhsb.org. Thank you for watching!